Okay, good evening, everyone. Welcome back again to this research course series. Today's webinar topic is literature review. And most of you would think why suddenly I am talking about literature review, why we are not talking about framing a research question. The reason simply being that the formation of research question takes a lot of input from the evidence or literature already available. By not looking at the available literature, we are simply going to run into the risk of reinventing the wheel. So inadequate literature review puts us to the risk of failing in putting the question in theoretical context. And if you look at this framework, which I'm going to show you, you would realize that your previous interrogation or query is based on prior information available to you. And through your intuition and experience, you would be able to frame this research question. Therefore, literature review would be available to you in some kind of a format in which is acting as a prior to your framing a question. We are going to talk about that format in this webinar. Okay, a brief introduction. We shall look at the research question. Research question is simply known as scientific query. And to prevent ambiguity and vagueness, the research question is quite clear. It should be concise and arguable. Good question is something around which you are centering your research. So a good question defines the focus of your research project, and good question sets the boundary to the research. This figure shows a framework of putting up a research question. If you see, there are call boxes and they represent the requirement of literature review or priors at various stages of development of a research question. So if you look at this figure, you will see there are call out boxes and LR is written over it, that is literature review. So you have some kind of previous information which is helping you with your experience and intuition in framing a research question. So all these boxes, that is reflection upon experience, doubt or theory, logical speculation, evidence-based questioning framework, literature search, and review of literature is going to help you with formulating a good question. So we are choosing literature review first in order to decide what kind of experience you have, what kind of doubt you have in order to frame a good question. Of course, we will go through the process of literature review again. Before jumping on to the literature review and its classification, we should know the types of professional literature available to us. So they are mainly of two types. One is the primary source and the secondary source. Primary sources are the author's original report of research which they have conducted. This information is available in form of journal articles where it is described under the heading of original research, thesis and dissertations, conference abstracts, and oral presentations. So if you would look for these kind of information on websites, you will see them in form of original research articles, unpublished thesis and dissertation, usually hosted by the universities, and conference abstracts or oral proceedings, which you may learn about in a conference. Secondary sources include those resources in which authors summarize their own work or the work of others. They are mainly books, chapters, and journal articles that review the literature. Editorials and opinion papers also fall under this purview. Practice guidelines and consensus papers also fall into secondary source purview, and these sources are considered secondary sources. Secondary sources are useful because they organize the literature for the reader and provide a ready list of primary sources on the topic of interest. Therefore, formation of secondary sources requires skill and understanding. Now, literature review can be discussed under these side headings, the gray boxes and the yellow boxes. The box which is highlighted is what we are going to discuss right now. So I would discuss about the levels of information available to you. Excuse me. Textbooks are the first level of information you go through in your career. And in the textbooks, which are partially based on evidence and partially based on what author thinks about, is combined with their experience and self-reflection. So this can be an expert opinion. Sadly, this credibility is not present in homegrown books on rehabilitation in India. and we don't have that much credibility in terms of research experience, and the expert opinions which is produced in this book goes through the consensus before it comes in the textbook. So however, by the time they are launched, the information is already on the verge of being obsolete. Now, the introduction, which is given under the original article, provides a snippet of information to understand the context of an original research, but it happens to be just a tip of iceberg, and it is sometimes inadequate, and this information has got many facets which the person who is going to study the article or review the article may find it difficult. So these bits of information cannot be used as evidence, and it does not give you a confident information in order to make a decision. Now this figure represents a hierarchical placement of various types of literature reviews, and on the y-axis you will see the confidence with which you can say that these literature reviews are contributing to the evidence in a given topic of interest. In short, the level of information you can rely upon to take decisions. So you can see this bright arrow, which is expanding and going towards the x-axis, and on the y-axis from the 0, you will see it's marked as low confidence, and to the highest point of the y-axis you see high confidence. So this tells you how much you can rely on these literature reviews in order to take a decision for an intervention. Now we come to the narrative reviews, the lowest form of literature review in this hierarchy. Narrative reviews summarize different primary studies from which conclusions can be drawn. These conclusions are holistic interpretation of the author and the few selected articles, and they are contributed by reviewers' own experience and self-reflection. They can also talk about the existing theories and the models in these self-reflections, and they can talk about something very vague in the title, and the conclusion can be somewhat different from what it is shown in the title. So here I give you an example of an article from Physiotherapy Journal. The title is Constraint-Induced Movement Therapy, a Narrative Review. So you may see this call out box which will ask you a question: what information does it give? So when you look at the objective of this article or journal article, the objective is to identify factors relevant to implementing constraint-induced movement therapy within the clinical setting. It has no relevance to this title of the narrative review. However, it can still be placed under this narrative review heading. If you see this, the result of this review are qualitative rather than quantitative. And the objective which is being presented in this journal article is about implementation. So do you think the title were expectations, the expectations were met in the title? Was the problem focused in the title? No. These types of review do not mention search strategies and inclusion criteria of the studies, and therefore may seem to be biased. These reviews are used in up-to-dates and continuing education, commentaries and editorials and overview of the articles. And if you look closely at these kind of articles, it will provide you the whole picture. It won't talk about specific details of a particular health condition, but it will talk about the whole picture. Now, narrative reviews do not follow answering specific quantitative research questions, and thus do not form a part of evidence to solve or decide for your patient problems or intervention. However, the good things are that they provoke thought and questioning, and it also provides content for the postgraduate students around the world. Now we come to another type of literature review that's known as scoping review. You might have heard of these scoping reviews in developmental medicine and child neurology. And the aim of this scoping review is to map existing literature in the field of interest. They take up various topics in terms of the volume written about that particular condition, the nature of the condition, and the characteristics of the primary research, that is the original articles. Now these scoping reviews try to fit in If I give you an example of outcome measures, and if I give you an example of ICF framework, now what kind of outcome measures would you like to map in particular domains? For example, ICF has got 3 domains: body structure, function, activity, and participation. Now, what entities or what outcome measures would you like to use to measure body structure and function? If I give an example about range of motion, I'll talk about goniometry. So I have this literature on goniometry available, and I have this information available, use of goniometry in cerebral palsy, and I will now map this information, that is goniometer can be used to measure range of motion in cerebral palsy, and map it to the particular body structure and body function in the health condition of cerebral palsy. Similarly, I'll use manual muscle testing, or I will use handheld dynamometer to measure muscle strength, which again falls in body structure and function. And now I will use a scale to measure participation in children with cerebral palsy, which comes under the domain of participation. So I have taken this particular framework of classifying functioning disability and health, and I'm taking the literature available for measuring participation. I have a literature available on what are the outcome measures used to measure participation in children with cerebral palsy, and I'm now combining and mapping it to form one scoping review. So these kind of reviews help in identification of key concepts and theories, and they may be requested prior to a big systematic review, and they help in preparing the costing to big research projects. Now, scoping reviews are excuse me, commonly used to understand phenomena and evaluate where research on a topic has or has not been completed. Scoping review is also undertaken in reviewing interdisciplinary topics, where review is time consuming and searching is also time consuming. And this may be important while knowing, before knowing or before doing any large scale projects. Now, full literature searching is aimed at retrieving a maximum number of relevant studies, and this will further increase the scope of a particular topic. So these are the kind of scoping reviews not seen much in journals apart from disability and rehabilitation. Now this slide shows you about rapid reviews, which you may have never heard of. Rapid reviews are undertaken in healthcare to meet the demands of decision maker and clinicians who ultimately need timely evidence to inform their decisions. Now, you must have heard of Zika virus, Ebola virus. You may have heard of new imaging techniques which can show you the images of the brain, and it can show you the real-time activity happening in the brain. Now, these reviews are increasingly becoming popular in healthcare, where you need fast decisions like Ebola, Zika virus, or changing some emerging need, or changing a healthcare management technique in order to improve, in order to turn the epidemiology or reverse the epidemiological mishappenings. Now, these reviews are increasingly popular in healthcare, where funding is granted on competitive basis, or when the body of researchers are required to take decision quickly in order to reverse, like I told you, epidemiological mishappenings. And rapid reviews also aim to be rigorous. They are transparent, they are explicit in method, but make concessions for timeline and utility of the output. That is, when a systematic review is performed, it may take years to get completed, and the conclusion will be available only after 3 to 4 years when any working group takes over it. But rapid reviews, since they compromise on the timeliness, they usually deliver information faster and they provide evidence faster. And these are the kind of reviews which find place in emerging needs of health technology assessment. They are not full-scale systematic reviews though. Now this is an example. This slide shows you example of physiotherapy after knee arthroscopy. This is a rapid review performed by Government of Canada. And this is a second article which is presented in Manual Therapy Journal. It talks about implementation fidelity of physiotherapists delivered group education and exercise intervention to promote self-management in people with OA and chronic low back pain. So I would ask you a question. Did you understand this title? How many of you understood this title? Implementation fidelity means degree to which implementation of intervention is delivered and is critical to the evidence-based practice. So it is necessary before you take on any research project about interventions, about the claiming that physiotherapy is helpful in particular condition, you would probably do a systematic review, or you would probably do a rapid review rather, for finding out whether physiotherapy intervention is delivered in the way it is given in the theory or not. I hope you understood it. Now, systematic reviews are the most superior form of literature review, and they have a focus question, which is a hallmark of systematic reviews. And these reviews can be further classified in qualitative and quantitative reviews. These reviews involve strict protocol, appraisal of the article, and the risk of bias is very low. The rigor of these reviews are very high. They are transparent. They can be replicated all throughout the world. And there are tables, which are also known as evidence tables, created in systematic review. Now, quantitative systematic reviews are also known as meta-analysis, and they involve a systematic review with strict protocol and calculation of effect size using pooling the data from all the studies. So if one particular good quality study has got 20 subjects and another good quality study has got 25 subjects, and there is third study which is a good quality study similar to experimental design, similar to the first two articles, then the data will be pooled up, and in short it will be 20 plus 20 plus 25. So you have got a larger group of patients, and you would be doing systematic review over it and use mathematical calculations in order to project the data to a larger population. Now, these reviews aim to make an objective science out of research synthesis. That is, the conclusions can be generalized to a larger population. Now, these are the main research literature reviews which you will see in journal articles, but there are some kind of reviews, literature reviews, which you may not find in physiotherapy, but they are important when you are trying to do systematic reviews, or when you're trying to know interdisciplinary sciences like psychology. Now, there are some reviews which get classified into integrative research preview, theoretical reviews, methodological reviews, thematic, and historical. Now, theoretical reviews describe the evaluation of theories. Theoretical review describes the evaluation of theories and how it is viewed from different contexts. Now, we have methodological reviews, which describe research designs, procedures, and methods undertaken to study the topic of interest. And they explore strength and weakness of methodological tools and explore how methods limit and open up opportunities for learning. Thematic reviews describe a particular learning model or an approach, and historical reviews analyze literature in a historical context. That is, they are used in studying evolution of educational policy. They are used in studying the evolution of societal developments, that is evolution of language and evolution of understanding a particular phenomena. Now, every review is developed while taking care not to deviate from the structure. They should be original in quality, and impact on the findings should depend on the inclusion and exclusion criteria. Now, there are keyword specific reviews, and there are data extraction methods which need to be provided when you are reporting systematic reviews. Similarly, they should have a theoretical framework, that is conceptual grounding or pragmatic framework, and it should list broad aims of the study, why it is done, and why at this time. Now, all the reviews before getting considered for evidence need to undergo evaluation, and the constructs of these reviews are appraised critically. Because each individual study has got a lot of shortcomings, they are missed right from the stage of conception of research to publication of research. Now, the reasons are many, but some of the reasons are: the editors look at the rigor and focus of the research content and overlook the biostatistics, or sometimes biostatistical resources are unavailable and they are unaffordable, and the researchers have little knowledge about statistical techniques, and it leads to dubious techniques of interpretation or calculation. Now, in incentive-driven academics like big universities, the researchers sometimes pay little attention to the study methodology because they need to publish at a faster rate. Now, there are two examples which are given in literature. One is about Williamson and colleagues, and they determined that only 25% of large design studies have positive findings. Another example is quoted by Moss and colleagues, and they report that 40% of pulmonary and critical care articles use a statistical technique, and they have used it wrong. That they have used it inappropriately. Therefore, the onus of excuse me, the research application and the responsibility to determine whether the results of...
Excuse me, Samin? Samin?
Yes, ma'am?
It's saying only 6 minutes left.
Oh, okay.
It's a free session and it's saying 6 minutes left. So you have to take a break and shift to my account.
Okay, ma'am.
Yeah, okay.
So the onus of the research application and the responsibility to determine whether the results of a published study are valid or not falls on the readers. Now, for this, readers need to have basic skills of evaluating research in order to believe the published results. Now, they have to apply it on the patient care, use best methods, diagnostics and trends, and so on. They need to understand epidemiological problems, and they need to understand appropriate allocation of health resources for certain activities or techniques, and for participating and managing research projects. So you need to have knowledge of all these things before you critically appraise an article. The appraisal is done through standard rating tools for an individual study, so that will be considered in the next session. And we need to choose scales which are appropriate for our purpose. Now, for rating randomized control trials, a type of study design, we have got many tools available. Now, which one will be applied for rehabilitation will be considered in a different seminar.